I'm going to tell you a little bit about my experience with sciatica and how I overcame it. So I guess I was probably around 24 years old, maybe 25 when it first started. I was working at a Christmas tree lot, and it didn't even happen while I was at work. It happened, I believe, the next day after I had worked the night before, and I was just sitting in my bedroom, and I started feeling tingling in my heel. I had already educated myself. I immediately just had a concern that I was going down the spiral of back pain one step further and experiencing the next step in the spiral, which was sciatica. So I knew I was just getting worse. And so I had it for many years. And at its worst, I felt pain and cramping in my quadriceps muscles and my hamstrings. I've even felt heat, like hot feelings in those muscles. So I believe one of the first things I tried was nerve flossing, which is when you go to a physical therapy clinic, they'll teach you what nerve flossing is. That didn't work for me. I tried, spinal decompression. They put you in a traction machine, or you can hang upside down in like a inversion table, and that would kind of open up the spine and provide some space between the discs and the vertebrae for the nerve to come out. But of course, it did not offer anything permanent. As I continued in my journey for several more years, I tried that many times in clinics. I bought my own teeter inversion table, tried a lot of different things, many rounds of physical therapy. Finally went to physical therapy school to dedicate my life to figuring this all out. And I remember being in class asking my professor to assess me, and I was having a lot of trouble sitting through the classes because of the sciatica. And after class he assessed me and he had me do the McKenzie technique, which is repetitive extension, and that made my sciatica significantly worse. And I actually went home from school after that, and I did not go back to school that day. I skipped the rest of the classes that day because I was in bed, and I didn't go to school the next day either. So it really worsened my condition, and that would be from a doctor of physical therapy giving me a treatment for sciatica, worsened my sciatica. And so we'll talk a little bit about why these things didn't work, and then I will tell you what ultimately did work for me when we talk about relief versus solutions. So let's talk about why something like repetitive extension works for some people but doesn't work for others with sciatica. So repetitive extension is like, if you know yoga, they have a movement called the cobra, where you're laying on your belly face down on the floor, and you push up and you do a backward bend. You're essentially extending your spine, backward bending. In physical therapy, they call this the McKenzie method, and you do it repetitively. It's like 10, maybe 20 times in a row. But if you have a condition like spinal stenosis, where the sciatica is being caused by basically too much backward bending of your spine, the back of the vertebrae are closing down, like in my case, then repetitive extension would make your condition significantly worse and potentially cause you, long-term damage. And so that relates back to my story, because the cause of my condition, of my sciatica, was too much extension. And so doing repetitive extension is not appropriate if you have stenosis. It may be appropriate if you have a herniated disc. It's probably not appropriate if you have degenerative disc disease, because there's not very much space there. So extension's closing that down further. And piriformis syndrome, it will probably do nothing for you, because the problem is not in the spine, it's more in the hip, in the deep hip muscles. And remember, there's even more causes of sciatica than just these four. The SI joint can be a cause of sciatica, and the treatment will be totally different. Okay, so I mentioned nerve flossing. Basically, it's gliding the nerve through its pathway, and to try and just get that nerve to move through your body and maybe loosen it up. And that can be actually more effective for the piriformis syndrome, but not so much for any of the other conditions. I haven't had a whole lot of success with it with myself or my patients. It's one of the most highly recommended things. One of the things that I want to clear up in the research that I was doing this morning in preparation for this was, I saw a lot of professionals out there saying, and especially on social media and platforms like YouTube, something like this: if you have sciatica, do this. And anytime someone says something like that, that should raise a red flag. Because sciatica is such a broad term and has so many different causes, there is no single solution, or, something like any of these would not be effective for everyone, not even close. I saw a lot of videos that said, do nerve flossing. Well, this made my condition worse. So did this one, repetitive extension. I never did surgery, but it's under the short-term relief method, because surgery actually can be an effective way to, remove the symptom of sciatica by cutting. Microdiscectomy could just snip the part of the disc that is pressing on the nerve, in the case that it is the disc causing sciatica. And so there's no more pressure on the nerve, and that's great. But that it offers relief, and it does nothing to address the root cause of the problem. That's just one thing I wanted to clarify, is if someone is saying, even a professional, if you have sciatica, do this, then that is not good advice. You should try it and listen to your body and feel how your body responds, but you should not just trust that this is going to be the solution for you and blindly listen to anyone, even me. Do not blindly listen to the information that I'm giving you and trust what I'm telling you. Do your own research and make your own decisions. I strongly encourage you to do that, as we're going to talk about in a little bit, that it's the best thing you can do to actually address the sciatica in a long-term perspective. There is another short-term relief method that I used that worked well for me, actually extremely well for me. And it is a video in the program. It's a lesson in the core balance training program. I believe it's called Short-Term Nerve Pain Relief Method. And it's where you lay on a pillow under your low abdomen. So you lay face down, put a pillow under your abdomen. It can be a thick pillow. This one worked for me because when you lay prone over a pillow, where the pillow is under your low abdomen, it actually opens up the back of your spine. So you can imagine the pillow under his abdomen, and it's pushing up in this direction on the vertebrae, and it opens up the back of the vertebrae. So if you have something like stenosis, then it will open up those closed down back of the vertebrae. And so that would be effective for you if you have stenosis and sciatica. It could potentially offer you relief, although it is short-term relief, and that can be extremely useful if you are in severe pain. It can allow you to, live life a little more. And then I also just want to mention that all of these conditions, plus more, usually overlap with each other. Someone may not have purely spinal stenosis, or purely a herniated or bulging disc, or purely a degenerative disc disease. They may have a little bit of all three, or a little bit of two of them, and a lot of one of them. This brings me to my final point for the day, my advice that I think will be the most helpful thing for you as a long-term solution to sciatica or chronic lower back pain. Is the only way that you can know what works for you and what doesn't is that you have to educate yourself. You need to think of your body as your domain that you are in control of, and the people that you go to for treatment, actually, instead of treatment, you should go to them for advice and education. The root of the word doctor comes from the word docere, which means to teach. And so that's what our role is in the medical system, is to teach our patients. And so I encourage you to be the ruler of your domain, of your body, and make your own decisions. So that leaves you with the question, so what do I do then, right? Once with all this education. This step 2 is one of the most valuable things that I could try and portray to you. And I believe that it's rare that people actually grasp what I'm trying to say, but you need to listen to your body and reflect on what it's telling you. It's like, what does that mean? So listening to your body is obviously when you're in pain, your body's yelling at you and speaking loudly, but it's breaking it down a little deeper than that. So say you're trying a short-term relief method and you do one of these, pick one, nerve flossing, and later in the day you feel a little worse. It's important to realize that nerves actually, they have a delayed response in many, many cases. And so when you do something now, it may actually, the result of that, you may feel later. It may be 10 minutes later, it may be even hours later. If you remember in my story, I didn't even start to feel the sciatica from the Christmas tree lot until the next day. And so when you get a message from your body like sciatica or like pain, the next thing you need to do is reflect back. What did I do recently? Okay. I did the nerve flossing. Okay. And I'm feeling a little worse than usual. I haven't done anything else different. So that's out. That didn't work for me. Everything else about my day has been usual. My pain is worse, and the only thing I did different was nerve flossing. So that's out. So that doesn't work for me. I need to try something else. Okay, let's try the McKenzie repetitive extension. Same thing. Okay, oh, maybe I feel a little better. Okay, great. I'm gonna record that. And actually, in that sense, I think one of the best tools you can use for sciatica, for getting over sciatica, or even any chronic condition is a journal. When you reflect back, after you've noticed some change in your body and you reflect back, you can actually record that so that you can have that logged for the future. And when you make decisions in the future about what you're going to do for your body, you can make those decisions from an informed place and be a little wiser. And if you do this over time, you can find the things that work for you and the things that don't work for you, continue to get more informed about your own body. And if you follow that general rule of doing more of what's working and less of what's hurting, there's only one direction to go, and that is to get better, to improve. And that's ultimately, my final long-term solution. If you know anything about me, if you've seen the masterclass, if you're a core balance training student, if you don't know anything about core balance training, we're about seeking muscular balance. We believe that the root cause of the vast majority of chronic lower back pain conditions is from muscle imbalances. And those are caused by lifestyle and the way we relate to our body and the way we move. So developing a healthier relationship with your body, a lot of that has to do with becoming more core centered and having your core more involved in your movement. And that takes time. That is not an overnight anything. It's not a short-term relief method. It's a long-term solution. And if you can bring your body back towards balance and incorporate some of the concepts of the program, like the breathing over time, I would put breathing in the short-term relief because it can offer amazing short-term relief for something like sciatica. And I've used it in the past with immediate effects, but you have to develop that skill of the breathing that we teach in the program. And that takes time. So it is, in that sense, it's a long-term solution. So these are the things that I believe to be the most valuable things that you can do in the long run. Long term, what do I mean by that? Maybe 3 months at the fastest, maybe 6 months if you're lucky. 6 months to a year would be a realistic timeline, but you got the whole rest of your life to deal with this. So that's a blink of an eye to me. And so that's my encouragement to you, and hopefully that helps you. And if we're going to apply this strategy to specific exercises that you're doing, then that involves doing the exercise, listening while you do the exercise, listening to your body, working yourself. And if that exercise triggers sciatic symptoms, then that's not a good thing. That's a bad thing. You want to back off and maybe even take a break and go do something that you are aware of that might be helpful, like going for a walk. And the next time you try that exercise, don't go to that point where you trigger the sciatica. You learned something about that last experience doing the exercise, where that threshold is. Try to go below that threshold, and with any exercise or any activity or any movement. And then the next time you do it, see if you can go a tiny bit further, 1% further, or more amplitude of movement or more intensity of movement without triggering that sciatica. And that would be progress if you can go 1% further. And then over a period of time, of weeks and months, it only takes, if you make 1% progress per day, it only takes 100 days to make 100% improvement. And that's a little more than 3 months. That would be this strategy applied to doing an exercise. And that takes reflection, to reflect back on the last time you did the exercise. If it triggered the sciatica, okay, how hard did I push it? Or maybe I'll reflect, look at my journal. Okay, I wrote down I was going at about 50% effort. It triggered sciatica at this point. Okay, this movement seems to make my sciatica worse. This movement or activity seems to make it better. Write that down and then refer to your journal regularly. And you can climb out of the spiral with a strategy like that. I believe it 100%. One way to know if you are experiencing improvement with sciatica is if what's called centralization of the symptoms. Centralization refers to the symptoms getting closer to the source. So if the symptoms are getting closer to your spine or wherever the nerve is being compressed, then that is improvement. Until next time, thank you all for being here. Be sure to hit that like button, support the stream, help spread the word to other people on YouTube that there is a solution to back pain. If you have any recommendations, feel free to post in the comments below any topic that you'd like to hear, and we'll see if we can make that happen. All right, thanks guys. Take care, and See you next week.